Hi, good evening. Welcome to the last live of the month. So we are just going to wait for a couple of minutes before we start. So those who are joining, you can just wait for a couple of more minutes before we start. This is the last live for the month. And today's topic is OCD, that is Obsessive Compulsive Disorder. So we'll just wait for a couple of minutes. Good evening, Ruhan. One more minute and we shall start. Hi, everyone. It's the time right now. Yeah. So those who are joining right now, this would be the last live for this particular month, and this month we have spoken about quite some interesting topics, and one disorder that we are going to discuss this month is OCD, Obsessive Compulsive Disorder, and OCD is also known as OCB, that is Obsessive Compulsive Behavior. So why it is often called or it is often diagnosed between disorder and behavior, the reason is sometimes it is the intensity is till the reach of a behavior, and sometimes it becomes a disorder. Now why and how, what, everything we are going to discuss. What are the treatments of OCD, because OCD is something almost 2.3% of the population across the world suffers from this particular disorder. All right, so I think we can just start today's discussion, and if you have any questions you can ask also. In fact, OCD, as the name suggests, Obsessive Compulsive Disorder. Now this is basically characterized by obsessive and compulsive thoughts and behavior. Now there are two categories, two particular words which are extremely important when it comes to OCD. One is obsession, one is compulsion. Now these two are mutually exclusive of each other, which means not every OCD person will have both obsession and compulsion together. They can sometimes have obsession, they can sometimes have compulsion, or they can sometimes have both, right? So as I said, it is like 2.3% of the population across the world suffers from OCD. Now 2.3%, when I'm saying, it is very important to understand here that in fact, most of us have some such compulsive thoughts, such compulsive behavior at certain point of our life. But when it starts interfering with our peace of mind, when it starts interfering with what we are doing, then it starts becoming an OCB, which is Obsessive Compulsive Behavior. But then when you start, continue to entertain such obsessive thoughts and then the compulsive behaviors along with it, slowly and steadily it becomes an OCD. Now, before I even start discussing all the nuances of this disorder, it is very important to understand that about 2 years ago, one of my college friends said that almost every woman has OCD. Now, thing is, it is not about women or men. Men and women equally have this disorder. It is not a woman-friendly disorder, or men do not have that, no. And I have seen many men suffering from OCD. Now, second thing is, this is one of the most common type of disorder. In fact, most of the people consider it as a part of their general personality. They don't feel that, it is... Thank you, Ruhan. So they don't feel that, it is extremely important that it needs some kind of clinical intervention. But the fact is, although people say that it is very normal, बहुत लोगों को होता है, this and that, but actually OCD is a kind of a disorder and it really needs certain intervention. Now, why it is that? Because OCD does not start with an OCD. It starts from a behavioral perspective. But when it remains untreated for a long period of time, that's the time when it suddenly starts becoming a disorder type. And while a lot of people think and a lot of people feel that it is okay to have such kind of behavior and disorder, just understand that maybe that person has inculcated those things as a part of their personality, but it is not an acceptable thing. Now, OCD was initially it was a part of anxiety disorder. People think that out of anxiety, a lot of people suffer from OCD, which is true also. But later on, the number of cases increased so much across the world till date that OCD has now become a separate category and cluster of disorders. It is called obsession and compulsive related disorders, right? So some common it is now, before we get into that, what is this obsession and what is this compulsion? So obsession are the thoughts, you know, the kind of thoughts that मेरे को ये डिजीज हुआ, मुझे ये हुआ, वो ऐसा ही सोचता है मेरे बारे में. So these obsessive thoughts, that is the O part of the OCD. But compulsive part is when you have to do something to justify the thoughts. For example, I can have an obsessive thought कि I have germs in my hands. I can just have this thought. I might not do anything. I might not go and wash my hands continuously. So in that case, I would be one of the patient of OCD with only obsession problem, not the compulsive problem. But if I have a compulsive problem too, that means that I will continuously wash the hands off to help myself with that thought of that I have germs in my hand. So if I just to explain it in much simpler terms, obsession are the thoughts and the feelings that we have when we have such intriguing thoughts which tells us that no, ऐसा ही होगा, ये बुरा होगा, मेरे हाथ में germs है, मेरे दरवाजे पे चाबी नहीं लगाया. So these kind of thoughts, most common are the washing hands. That's the most common one. And if I have locked my house properly or not. But if I don't do anything, if I don't come back every time in the house to check ki locked sahi se laga ki nahi, then I don't have the compulsive problem. I only have the O problem, that is obsession problem. But when I have the compulsive problem, I will come 21 times to check, just an arbitrary number I'm saying. So 21 times to check that the house is locked or not. I'm not never satisfied with what I'm doing. I'm continuously washing my hands because I think there are too much of germs in my hand, or I'm continuously stalking somebody's profile because I have this feeling that somebody is talking to someone which I am not aware of. So OCD, as I am saying, there are two variants of it, obsession and compulsion. Not both, it is not mandatory for a person to have both of them, but you can have both of them also, or you can have only a part of it also. Okay. If you have any questions so far, please feel free to ask, because OCD is something, even if you have not suffered from it, at least you would know somebody who has suffered from it. And it is not about only washing hands or opening the, whether the house is locked. It can also be, especially after COVID, it can also be that whether the house, whether the bed sheet is clean or not, if somebody from outside have come, constantly sanitizing because the fear of COVID has become such intriguing for me. Or I have some problem somewhere, let's say I have a cut in my hand, I'm constantly checking it, thinking that it will get aggravated, whether my hand is going to be cut off or something like that. So there are different variations of OCD. I'm going to talk about all of them. All right. Now, any questions, anyone so far? I just discussed the major part of OCD, which is obsession, compulsion, or you can have both of them, obsessive compulsive disorder. Now, I generally don't like calling anything as a disorder, because the moment I call it a disorder, it just immediately makes a person paranoid. It makes a person scared. So I usually call it as OCB. It is obsessive compulsive behavior. But it is classified as a separate category of disorder, because many sections are there which I have at a point, and I will discuss all of that. Okay. So what can be the diagnosis? How do you understand that somebody is suffering from OCD? First is, they will not be able to control their thoughts or behaviors, no matter what you do. They will just not be able to control their thoughts or behaviors. They want to distract their mind, but they're constantly, this background music is going on inside their head. They are not able to control that. The next thing is this constant thought, this constant thoughts of obsessive behavior or anything that is continuing for at least over a period of 1 hour every day. More than an hour every day you are spending on thinking on these compulsive thoughts, behaviors, everything. Constantly, extremely focused on that only and nothing else. That is another symptom of OCD. The third is experiencing significant problems or thoughts in the daily life. So it is impacting your daily life. So even if you're not thinking 24 hours, you might be thinking for 1 or 2 hours, but then the rest of the hours is also getting impacted because of the intensity with which you are continuously thinking on this 1 or 2 hours throughout the day. So it is impacting the pleasure time or the me time or any family time. It impacts your relationships with people. People start avoiding you. People think you have some problem. So these kind of things happened. A little late, but it is okay. Ageta pore to dekhe nish, because I just discussed what is the obsession, what is compulsion, whether you really need to have both of them or which part of it can still classify as an OCD. Right now I'm just discussing the symptoms of OCD. And most importantly, they don't get pleasure from their thoughts. It is not that they will think and they will find, acha soch liya, I am feeling good. No, they will think and they will find more miserable. They will feel even more miserable than before. That is the problem with OCD. And most importantly, somebody who is suffering from both O and C part of the OCD, first of all, they will not get any relief from their thoughts. The second part is they will do something to get relief because their brain feels it's a loop. I am thinking, I am feeling anxious, so I am doing this to relieve that anxiety. It's a continuous loop that is going on in the mind of an OCD person. And they will not be able to come out of the loop. That is whether it can be related to any physical disorder, it can be related to any health related issue, it can be related to germs in my hands, it can be related to whether I've locked, whether I have switched off the regulator of the gas cylinder. Especially happens with people when they go for a long trip. घर में सब lights बंद किया, सब कुछ पंखा वंखा बंद है ना, एग्जॉस्ट फैन तो चला के नहीं आए, गीजर बंद था तो. So all this kind of question starts coming up. Some people can just shoo them off and say, अरे हाँ सब कुछ किया, अभी तो वापस नहीं जा सकते, छोड़ो. And some people, no matter throughout the travel, they will keep on thinking about it and will try to find a way if somebody can confirm it with them. That is an obsessive part. The compulsive part would have been, नहीं मैं जाके देख कर आती हूँ, बाद में आती हूँ. And they will come actually to see themselves. They don't trust others. They don't trust others telling them unless they are satisfied. That is how OCD makes you come into a loop, continuous loop, right? So what can be the certain, I learned a lot from you. Thank you so much, Ruhan. So what do you what do we think, like after so much of research on OCD, ideally there are no such causes for OCD, one thing is definitely there is some brain circuit issue that our brain, every second we are being bombarded with many information around us, but we tend to take only few information within our sense organs. Like let's say right now I'm talking to you, you might be hearing some bus moving around your house, some noise, some other noise. So there are 40,000 information per second that comes to our nervous system. Now, if all the 40,000 information is processed by our nervous system, then we would have become mad, insane. So what our brain does is they just filter and take some information based on your so much of upbringing, your filters, your biases, what you consider as important and everything. In case of OCD, it has been seen that such filters, such thought process, the circuit which actually filters the information in the brain, that somehow gets a little haywire. That does not work properly, because of which the unwanted thought, the not useful thoughts are also coming inside. So the brain is not able to filter कि ये important नहीं है, इसको छोड़ो, ये important इसको रखो. They just letting everything come. So when everything is coming in, useful, not useful, everything is actually getting inside the brain. That is one reason, which is called the biological cause. The second reason can also be genetic cause, like some genes are present or somebody in the family already has OCD. If somebody in the family has OCD, direct family, not extended, then 25% chances are there for you to have OCD. And again, I'm saying there is no scientific proven mechanism which says that only female have OCD. Men, women both have OCDs equally. Okay, and 2.3% of the world population suffers from OCD. All right. So the now thing which is more important is, what are the categories of OCD? What are the different categories? Like, what comes under OCD? First is the body dysmorphic disorder. Now, what is body dysmorphic disorder? Body dysmorphic disorder is when you're not happy with certain part of your body. When you think your nose is crooked, you are a little squint, your lips have certain problems, your hands are not in shape, you are not in shape. So you continue to think like this. So that way you are never happy with the shape of your body or body parts. That is one body dysmorphic disorder. The next is olfactory disorder. Now, what is olfactory disorder? You feel there is this consistent obsession that you get a very bad smell around somebody, or that person always comes in and you get a smell. Maybe there is no scientific reason for that, but you feel that is how it is. So that is an olfactory part of the OCD. The third part, my favorite, is hypochondriasis. Hypochondriasis is a part of OCD. Now, what is hypochondriasis? Hypochondriasis is whatever little thing happens in your body, in your physically, you just flare it up and you start thinking ki sab bahut bada cheez ho gaya, and you are not able to come out of that loop. The thing is that you continuously keep on thinking that nahi yahi cheez hua hai, this is the problem, and I cannot come out of this loop, and if some pain is happening in my chest, I will have heart attack. If some bruises are there, maybe they have to cut my hand off. So, absolutely aggravated understanding of a very minor or may not be too much major issues. Okay. The next one is hoarding. Hoarding disorder happened at an extreme rate during COVID. What is hoarding? People, out of being afraid that things will run out of stock, they start hoarding things in their home. So during COVID, many people kept on buying so much of sanitizer, because of which there was a lot of scarcity of sanitizer in the market. People used to hoard rice and dal and everything with the fear that lockdown can happen. So this is a hoarding disorder. Now, some people did it out of panic, but the moment they understood that even after lockdown things were available, they stopped. But some people continued to do that. They never stopped. Then that became a hoarding disorder out of panic. Finally, the other one is substance-induced disorder, which means that when you take in a substance, at that particular time, you have some obsessive thoughts, and then you take in a substance to calm that down. Again, you have the obsessive thought when the substance trance is over. Again, so it becomes like a loop. It's a constant loop that is happening. So the question is, if OCD is this common, where 2.3% of the world population is suffering from OCD, what are the treatment for OCD? Ideally, if you see, OCD does not have any medical pharmacological treatment. Even people, when they give you medicines, it is about anxiety, anti-anxiety pills, but that does not help in any case. So OCD treatment starts, the very first treatment of OCD is called systematic desensitization. What is systematic desensitization? You have certain triggers, like something happens and immediately you start getting into that loop of the negative thoughts. Let's say, for example, I have some health problem, and then suddenly that part of my body starts paining a little bit. Immediately I start getting into that spiral of the negative thoughts, spiral of obsessive thoughts. And if I just have thoughts, then it's okay. But then again, I have to continuously check, think, अरे USG कराने जाना पड़ेगा, appointment ले लो, ये कर लो, वो कर लो, डॉक्टर से बात करो, और भी दूसरा डॉक्टर से बात करो. Then it becomes a compulsion that I have to do this. So I'm just talking about the hypochondriasis part of OCD. So systematic আমার net issue হচ্ছে, I'm losing the life again and again. আচ্ছা, পরে দেখে নিস তাহলে পুরোটা একবার. আপাতত let's just discuss the therapeutic point of view. Systematic desensitization is desensitizing the triggers over a period of time, and it starts with my magic trick, which is called PMR. PMR, that is progressive muscle relaxation. Now, what happens in anxiety? Anxiety is, or OCD for that matter, it is extremely psychological plus physiological, because when you have these obsessive thoughts, either your hands become very cold, or you keep on doing like this, continuously like this, or your palpitation increases, or you feel that you are breathless, you are not able to keep up to your breath, or you feel that, all kind of physiological issues you start feeling, right? So progressive muscle relaxation, or PMR, what it does is it basically starts releasing those anxiety, tension, or any stress from each part of the muscles. So it starts releasing those muscle groups of tension. And this is the first part of systematic desensitization. After that, what happens is exposure therapy. Now, what is exposure therapy? So let's say I have a problem and I get very cold hand whenever I think of that. Let's say public speaking. I feel that everybody is going to laugh at me and I will never go over there. And so this becomes an obsessive thought that I will never try. No longer an anxiety, but an obsessive thought. Or I continuously think that, my eyes are not proper, everybody's laughing at me, and that's why I always try to close my eyes like this and go out in the public. So that becomes an obsessive thought. So what I do is, I first of all do the PMR for the systematic relaxation, just to release those tension that has accumulated in each part of the muscle. After that, I start exposure therapy in limited degrees. The exposure therapy is what? I expose you to that problem while relaxing your muscles. So our body gets conditioned to a particular physiological and psychological response. That whenever ये झमेला होगा, मुझे गुस्सा आएगा, या फिर ये चीज होगा, then I will feel palpitation. But what I now do is I give you the same situation, but I don't allow you to feel that palpitation. So now the brain becomes confused. कि ये क्या हो रहा है? That I am facing that, but I don't. Good evening, Devjani. But I don't feel that palpitation anymore. So like this, what happens? We start removing the physiological part from the psychological part. So 50% of the problem is solved. And slowly and steadily through exposure therapy, you start controlling your physiological responses, which impacts your psychological state of being also. So as I told before also in one of the lives, if you sit like this and I ask you to laugh, you will not be able to laugh properly. In your case, breathing problem starts. Yes, palpitation. So you will sit like this and you will not feel like laughing. The reason is the moment I sit like this, my body starts sending a signal to the brain that I am not fine. So let's see if I am not fine and I'm constantly lying down. I will not feel fine. I will actually not feel fine. That's why during my COVID time also, I kept on working. I kept on moving around the house. I kept on moving, walking, doing something. Because I knew that if I just lie down throughout the day, it will impact me psychologically. And then COVID would become a psychosomatic illness. Psychosomatic illness means this illness does not exist. But by making myself believe that I am not well, I actually aggravated the problem. Maybe the problem was this much. But by thinking and believing into this, I have aggravated the problem to this much. That is called hypochondriasis and part of OCD. So systematic desensitization helps in cutting the triggers, helps you to relax, and then starts the exposure therapy. These are the two main techniques of solving OCD across the world. Okay. So exposure therapy and systematic desensitization helps you to cognitively think that this is actually not true what you are thinking by doing it in regular intervals. I will not expose. For people who have fear of heights, I will not let them go into the airplane and tell them jump from there, you have a parachute. They won't be able to do. They will die of heart attack. So it has to be done like जिसको height का issue है, पहले उसको छत पे, then from there a little bit more, little from there to merry-go-round. So धीरे धीरे it increases through the exposure therapy. Apart from that, of course, CBT is there, which is cognitive behavior therapy, where we start working on the way you think. It is not that I will first do systematic, then do exposure, then do CBT. It all happens very nicely. You would not know, as a person who is suffering from OCD, they would not know what we are doing. But it is very nicely entwined that ek saath bahut sare issues starts getting addressed. Then definitely aromatherapy. Aromatherapy works wonders because brain is getting impacted. So if a particular oil, I will tell you the name, rose oil. let's say rose oil, the smell of rose oil is going through your nose. It basically, the first thing it impacts is here, which is the olfactory bulb. The olfactory bulb then sends the signal to hypothalamus. Hypothalamus is actually the emotion controller part of the brain, which controls the way we react and way we think. So this rose oil, it goes like this and it calms down and it reduces the cortisol amount in the brain, and automatically we calm down. That's why you people who know me, they would see that I always say that keep rose oil and lavender oil along with you, because they are like lifesavers. They are just saves lives in this kind of situation, and they don't have any side effects. That's the best part. Apart from that, yes, there is medication. As I said, that will be my last option always. Medication is important only when nothing else has worked. But again, OCD really doesn't have any medication. It is basically anti-anxiety pills, which just calms you down for some time, but it does not solve the problem from the root. Isko chhod ke, there is one more technique. I don't know if it's there in India or not, but that technique is called transcranial magnetic stimulation, TMS. Transcranial magnetic stimulation, pehle zamane mein they used to give electric shock, right? But nowadays it is not considered as legal anymore. So transcranial magnetic stimulation is, they will put certain circuits in the brain, and then they will use a magnetic strip, and they will put the magnetic strip like this. So what happens is, what work used to be done with the help of the electric shocks, the transcranial magnetic stimulation sends that stimulation in my brain and tries to fix it. Like whatever circuit problem has happened biologically, it tries to fix it. Good evening, Abhinanda. But the thing is, that is the last step. You really don't need to do transcranial magnetic stimulation. 80% of the problem gets solved with the first three, that is systematic desensitization, exposure therapy, and of course the cognitive behavior therapy. It is only when none of this is working, then only you need a medication. And TMS is, I will never recommend TMS to anybody, but 80% of the problem gets solved, OCD gets solved. Now there are a lot of people who will tell you OCD kabhi solve nahi hota. That's an absolute lie, huh? Because they never wanted it to solve. A, they were told that it will never get solved. B, C, they've never trusted somebody who could actually help them to come out of this. C, and D is, they feel it is very normal to have OCD. The reason why it is called OCD, it is not normal, that is why. A little bit of OCD is okay, even I have it. You know, पेन को इधर रखा तो ऐसे ही रखो, उसको ऐसे क्यों घुमाया, उतना ठीक है. घर में कोई आए, इसको गंदा दिखता है तो उसको साफ कर दो. That much is okay. But constantly thinking, otherwise you get breathing problem, you get palpitation, then it's a problem. Even if it's not a disorder, it is still a problem. So it is very important that you identify at which stage of OCD you are and take help. There is no problem in asking for help. Just take help, start these practices, and you will get out of OCD in no time. Trust me, I have brought out people out of OCD, and the only thing is, if they have continued the practices over a long period of time, they would be able to come out, because medication gives you instant relief but no proper result. But these techniques will actually help you to get proper result but not instant relief. So you have to have that patience, right? So that's pretty much about OCD. I hope I have been able to add some values to those people who had questions about it. Those who could not watch the complete live, I would say watch it completely to have a proper understanding. Otherwise, half-baked cake is equivalent to no cake only. Alright, so take care everyone. Seek help when it is required. I'm not saying you have to seek help from me. You can seek help from whoever you trust, but do seek help, because it's important not to have OCD if it is impacting your daily life. Alright, thank you everyone. Take care.